Hi, and welcome to Carolina Women. We are here today at Custom Audio Video. We are talking, and our first guest, Miss Allison from Rehab. Super excited to see you today. I know, it's been a whole month. I can't even believe it.
I know, it goes by fast.
You know what? We were just talking before we started a little bit about what we're going to be discussing today, and it's really interesting because I think many of us, when we feel like we have a problem, think surgery. Quick fix,
Right.
whatever. Let's talk a little bit about.
Sure, so we see a lot of patients that are told surgery is their only option, and they think it's going to be a quick fix. However, what happens is, especially when you're treating pelvic conditions, there is no quick fix, for one.
All right.
Is that because it's muscular?
Well, it's because there's usually three main underlying causes for conditions such as pelvic organ prolapse or diastasis recti or bladder issues, and usually it's a combination of three things.
Okay.
One, it's pelvic floor muscle weakness, right, which surgery is not going to fix that problem. You're going to have to work to fix that problem, right? Two, it's usually poor management. I know we've talked a lot about that intra-abdominal pressure. So if our patients aren't learning to manage that pressure properly with their core system, a lot of times what happens is everything kind of goes down to the pelvic floor. And even if you do have surgery, whether it be mesh or there's so many different options, a lot of times patients aren't happy with their results because they never address those underlying causes.
It's really funny. I think about that all the time when we've talked before about core. I find that I'm more aware of it.
That's half the battle.
No, but do you do that too? Do you find yourself, even when you're walking around, kind of paying attention to core? And
yes, I'm always aware, or especially when I'm lifting, or even when I go to pick up my 6-year-old who still likes to be held, by the way. Sometimes I'm like, okay, brace myself first, lift up, you know.
Right, exactly.
Well, so are you finding though that people do not end up having to do the surgery if they go through a program and work?
Yes. So 9 times out of 10, our patients avoid surgery because they are addressing all of their underlying issues. Now, I'm not saying we can always cure a prolapse, right?
Okay.
There are cases where it's pretty significant. However, we have patients that a lot of the symptoms are that heaviness, that pressure, difficulty with bowel and bladder movements. Those symptoms can all be improved. And so patients are usually really excited if those symptoms improve, then they're like, well, maybe I don't need to have surgery. Or I had one patient that said, my doctor said, that a hysterectomy is my only option. She's 35.
Okay.
Okay, so that's going to throw her into early menopause. And I said, well, let's at least try therapy.
Correct.
Because that's a very
worst thing.
extreme option. And so she did avoid surgery. So that, and she wanted another child. So that's huge.
So
right?
what I hear you say is there's not necessarily kind of a one treatment fix for everyone. There are a lot of different ways. So, for example, if a patient comes in, can they just come in because they're having general pelvic floor issues and you help, I guess, diagnose and then create that treatment?
Oh yeah, that's exactly what we do. And that's like our favorite thing to do. And so when you come for your first visit, it's an initial evaluation. So we spend about an hour and 15 minutes just with completely evaluating you to see what the underlying causes are, what's going on, what we want to work on. And every single person is different. There are those common trends though that we see. With usually it's that core and pelvic floor weakness or extreme tightness or poor posture habits, poor bowel and bladder habits. So there are some common trends that we see.
Every age, every demographic, every woman.
Everyone.
And early prevention. Like come in at the first signs. Don't wait.
Yeah, don't wait until it's
better.
and if you catch things early, you can really do yourself a favor and avoid problems in the future. And also, especially, you don't have to be pregnant or postpartum to come see us. But we do see a lot of women during pregnancy because we're able to guide them through and then help them avoid having problems afterwards.
I wish we had known that when we were having our kids. Right? I think it would have been really.
I didn't have me either. I'm like, oh man.
It's always fun. We always learn so much. It's really interesting, and I think kind of demystifying and destigmatizing all this good stuff.
Demonstrate one of the exercises.
As always, I wear my boy shorts whenever she's coming because I know it's going to involve some kind
of. And you did really good that time.
Exactly. It's always a treat to see you. Stay with us. A lot more to come here on Carolina Women.